use at-home COVID tests anytime soon. We want to make sure these are accurate. The FDA just released new expiration dates for several at-home kits. Depending on the company, the date may have extended beyond what's printed on the package, so you can find the full list on our website, WFAA.com. That tops COVID news. For more on that and other health headlines, let's bring in our medical expert, Dr. David Winter from Baylor Scott & White Health. Good morning. It is good to see you.
Good morning. Good to see you.
Okay, Dr. Winter, first I want to talk about Trevor Reed because he's finally back in the United States from Russia. He's being evaluated in a military hospital for possibly tuberculosis. So let's break down what is tuberculosis, what this could mean also for Trevor.
Yeah, Sonia, tuberculosis is pretty uncommon in America right now. The reason is we're relatively resistant. 90% of folks who come in contact with the tuberculosis don't get it. They have no symptoms. Now, that wasn't true back in the early 1900s. It was a common illness, a common cause of death. We think the difference is good sanitation and good nutrition. Now, I'm not sure that's true in Russian prisons. In fact, I suspect it's not true over there. We don't know for sure if Trevor Reed did get tuberculosis, but the good news is if he did, there's very good medication now to treat that.
And you mentioned nutrition. We know that he's gone on at least one hunger strike while there, so that'll be interesting to watch his progress in the weeks and months to come. Big COVID news this week. Moderna has asked the FDA for emergency use authorization to distribute their vaccine to children under age 6. So how important is this at this juncture for young children?
Yeah, this is very good news. Right now, there is no approved COVID vaccine for children under age 6. So this is good news. Moderna did their own study of 6,700 young kids. They found that the vaccine did work. It's a quarter the dose of the adult vaccine, and there were no significant side effects. So this is very welcome news. We hope the FDA will approve this. We understand Pfizer's also on their heels. They've got one coming also. So hopefully soon we'll have a vaccine for young children, and maybe two different ones from two different companies.
So, Dr. Winter, let's say this EUA goes through. Thinking about the current trend in terms of COVID cases in America, when would you go get your child vaccinated?
Yeah, I think it's a very good question. If they're approved, I think it'd be good to get them done right away, particularly if they have any immune problems. Those are most, I think, important there. Or if their parents or grandparents at home that have some immune problems or some frail conditions. Very important there. But for any kid you want to keep healthy, I think the vaccines are a good idea.
We just talked about these at-home COVID tests. I know people who are traveling especially are still, collecting them and doing their at-home testing. What do you think about the expiration dates, or what are you advising patients in terms of when to take those, what to look for, which ones are accurate?
Yeah, these over-the-counter rapid tests, they're very good, but you have to know when to use these because early on, sometimes they can be false negative, meaning you have the disease and it doesn't show that. So what we're saying is if you think you have a COVID symptoms and you test one of those kits and it's negative and you have symptoms, test again in 2 days. If that one is negative, you're probably fine. And of course, with this new information, make sure that the test is not expired. Make sure it's still a good test.
Okay, I got to check mine at home too. This week also new recommendations announced regarding the use of aspirin daily to prevent heart attacks. So this is from the U.S. Preventive Services Task Force. It really echoes the 2019 recommendations from the American Heart Association and the American College of Cardiology. So who should be taking aspirin? Who should not? Can you just clear this up for us?
Yeah, so aspirin can help prevent heart attacks. It can also cause internal bleeding. Now, first, let me point out that if you've had a heart attack, if you've had bypass surgery or have stents in your heart and you're taking aspirin, you should not stop that. Talk to your physician if you have questions about that, but that's what's extremely useful right there. If you're 60 years old and haven't had any kind of heart problems, then your risk of bleeding may be higher than your benefit. So those folks may not need aspirin. If you're 45 to 60 and have some risk factors, for example, a strong history of heart disease in your family, very high cholesterol levels, you might ought to take an aspirin tablet. None of these decisions should be made by yourself. So talk to your doctor about this, but there are pros and cons for taking aspirin. It can help, but it can hurt.
Well, I appreciate the clarification on that because this is not just one big headline. Dr. Winter, thank you so much, as always.
You bet. Thank you. Have a good weekend. Thank you.
Thanks, you too.